Good afternoon, everyone, and thank you for making time to join us for this session. My name is Maharada Krishnan, and I'm a Chief Medical Officer at Biogen, a pioneer in neuroscience, specializing in the discovery, development, and delivery of therapies for the treatment of neurological diseases. It's my pleasure to welcome you to our Climate Week panel, Protecting Patients from Climate Risks, a conversation with Frontline Health Clinics on resources. As a proud sponsor of the Boston Globe's Climate Week, I want to thank the Globe on behalf of Biogen for dedicating a full week to the discussion of our climate and convening these important events. I also want to thank our colleagues from Harvard Chan Sea Change, AmeriCares, the National Association of Community Health Centers, and the Community Care Clinic of DARS in Nags Head, North Carolina, who have joined us today to discuss how climate change is currently impacting health choices and their ability to care for their patients, and how new tools that have been developed are helping them mitigate the effects of extreme weather as a result of climate change. Biogen has a vested interest in climate, health, and equity in Massachusetts as a company based here in Cambridge. 2 years ago, we committed to become fossil fuel free across global operations by 2040 and accelerate the action on the intersection of climate, health, and equity through our Healthy Climate, Healthy Lives initiative, the first to launch such a commitment among Fortune 500 companies. As a healthcare company, we knew that we couldn't lead in human health without addressing our operational and community impact. We're also using our platform to advocate for climate action by working with leading institutions. One, by advancing the science on air pollution. Secondly, creating new roadmaps to mitigate climate impacts. And thirdly, to help under-resourced healthcare clinics to address climate risks and human health. The scientific community resoundingly agrees that the climate crisis is an urgent threat to human life and well-being. Not only does burning fossil fuel cause climate change, research shows that fossil fuel emissions are a leading cause of death globally, claiming more than 9 million lives each year. In the US, roughly 1 in 15 deaths is attributed to fossil fuel emissions and air pollution. And here in Massachusetts, they are responsible for almost 3,000 deaths a year, 5% of all deaths in the state. While all of us experience the negative health impacts of climate change, these effects are disproportionately felt by the vulnerable populations, including residents of low-income neighborhoods, minority groups, children, the elderly, and people with pre-existing health conditions. Not all climate actions deliver equal results, but we have an urgent opportunity to take climate action that also benefits public health. Our goal is to create an equitable future where everyone has access to a healthier climate and can live a healthier life. For example, through our work with the Harvard Chan Sea Change and AmeriCares, we are bringing the newly developed Climate Resilience for Frontline Clinics Toolkit, formally launched today, to health clinics in underserved communities. The toolkit has resources for clinic administrators, providers, and patients to help better manage and prepare for the common climate change risks. Resources are available in the toolkit on extreme heat, wildfires, hurricanes, and floods. During today's discussion, you will learn more about the climate risks that health clinics are encountering and how the toolkit can assist mitigating those risks that I'm really looking forward to hearing. How our collective efforts are really helping enhance resilience and improve the health of people throughout the country. With that, I will now turn the discussion on to Dr. Aaron Bernstein of Harvard Chan Sea Change to introduce our panelists. Thank you.
Thanks so much, Dr. Radhakrishnan. Welcome, everyone. Delighted to have you with us today. We're here, as you heard from Dr. Radhakrishnan, to launch a new set of resources, a toolkit that has been developed to provide greater resilience to the frontline clinics that serve some of the most vulnerable people living in the United States. We have an absolutely terrific panel of people to discuss both the origins of this work, but also hear from people who are working on the front lines of our health system and how they see the reality of climate change playing out in their clinical experience, as well as from organizations that really are working to coordinate response to climate change in our frontline health clinics. So with that, I would like to ask our panelists to turn their videos on and allow me to introduce them briefly. I, in no particular order, will introduce our panelists and welcome them to our launch event. I'll start with Alex Hodges. Alex is a nurse practitioner at the community clinic of Dare in Nags Head, as you heard. Welcome, Alex. She's currently in transit, and we're very grateful for her taking the time. She has been a stalwart partner in this work to date. Rebecca Rogers, Dr. Rebecca Rogers is here. She's an internist who works at the Cambridge Health Alliance and has also been enormously helpful in helping us think through the development of the toolkit that's launching today. Ben Money. Ben is the Senior Vice President for Public Health Priorities at the National Association of Community Health Centers. Ben has been spearheading the work of NAC, as it is called, on climate resilience, and we're delighted to have Ben with us today. And Kristen Stevens is the Senior Director of Climate and Disaster Resilience at AmeriCares. I will be asking our panelists some questions, but I encourage everyone here to put questions that arise in the Q&A feature available through Zoom, and we will get to as many of those as we can as well. Without further ado, I'm going to start with Kristen, who's been involved with this project from the very beginning. And I wanted you, Kristen, to maybe give a few words about the genesis of this project, how it got started, and why you think it's important for clinics to be thinking about climate risks from your work at AmeriCares.
Yeah, thanks so much. And thanks for having us today. This project came about through AmeriCare's long history in responding to disasters. We have seen over the 40 years that we've been in business, the impact that disasters have on community health centers and the communities that they serve. At AmeriCares, our preparedness work really got underway following the 2017 hurricanes in the United States. And one of the things that we've been seeing over time is the increasing impact of the climate crisis on disasters. We've seen a growing awareness with clinics that they need to be prepared for disasters. Even just 5 years ago, when we started all of this, we would have clinics that would say, you know, we don't get disasters here. This doesn't really impact us, but this sounds like a good thing to do, and they would engage with us. But over time, and especially with COVID, people have really seen that this is important and this is something that they need to address. So knowing that, we started thinking about what would climate resilience look like for the partners that we serve. And with that, we began engaging with Harvard and thinking about how can we get together to do a multi-pronged approach for climate resilience. And that's what we've sought to do with this toolkit, is bringing together the best of AmeriCare's operational on-the-ground expertise with Harvard's clinical knowledge, so that we can serve administrators and help keep the buildings open, serve clinicians and help them give the best possible information and guidance they can to their patients, and to serve patients to give them the best information possible so that they can take care of themselves during disasters.
Thanks, Kristen. And your comments speak to a reality of what it's like to deal with the climate crisis in a clinic. And I couldn't be more delighted to have two people with us here who have, I think, real firsthand experience with that reality. And I want to turn now to Alex and Dr. Rogers. And Alex, start with you. I just would be really grateful to hear your thoughts about how, in your work at the Dare Clinic, you've seen climate change appear in the care you try and deliver, because I think it's not always thought of, climate change is not always thought of as something that really matters to how people like you do your jobs.
Absolutely. Again, thank you so much for having me and working with me today. So, ironically, when I began as a nurse practitioner, I don't know that climate change came on my radar. Even though I lived on Hatteras Island and I've been there for over 30 years now, um, I've seen hurricanes, I've seen flooding. I didn't understand the impact that our climate has on our patients. And seeing in our clinic, a great example is a patient that had diabetes and high blood pressure, and he didn't think his work outside put him at risk for dehydration, and that he should just keep taking his blood pressure medicine. And he got dehydrated, and he dropped his blood sugar, and he ended up in the hospital. This packet would have hopefully helped with that. We actually met with him afterwards and talked about that, and it's brought to the forefront. I also teach at East Carolina University nurse practitioners, and we don't really talk a lot about climate and how to adjust medications and be mindful. Telling your insulin dependent diabetic to be mindful. We've got a nor'easter coming and we're going to lose power. You need to have your insulin. You need to have a cooler with ice. Just simple, small, little facts that aren't on our everyday radar. Living on the Outer Banks is a unique area. We really have one road in, one road out. We have no major hospital. We experience coastal flooding. We experience hurricanes. We experience heat. The majority of my patients at the Community Care Clinic of Dare, they're working outside. They're in construction, or they're in the boat building business, or they're doing cleaning cottages, et cetera. So they are very vulnerable, not only to the outside forces, but they're already vulnerable because they're meeting the low income of our clinic to be able to receive care.
Wow, thanks, Alex. That's quite a lot of insights from a part of the country that many may be familiar with through its reputation as a place that people go on vacation. But the reality for people who live there is, I think, as to your case, very different. I want to now turn with a similar question to you, Dr. Rogers. You're working in Cambridge, which is not the Outer Banks. And I know you've been really engaged on issues around climate for a while. And so it'd be really compelling to hear your perspectives on this issue. How do you see climate change mattering to what you do as an internist at Cambridge Health Alliance?
Yeah, thanks so much. Well, I just want to say that climate change is a thing that I have always known about my entire life. I can't remember a childhood where I didn't know about, as we called it, global warming and the greenhouse effect at that time. And now in my role as an internist, primary care doctor, and the relationships I've built with patients over time, things like this toolkit are really great to sort of build upon the relationship I have with patients, the knowledge I have about climate change, and to sort of educate patients about how climate change might be affecting their health. The things I think that we are seeing most in the ground here in the Cambridge Somerville area, a very similar story to what we heard before. We have a lot of patients who work outside during the day. And actually, the week that I first got the first draft of this toolkit, I had 2 patients come to the office that week, it was the summertime, and say, this week has been really hard at work. I felt really sick at the end of the day of work every day. Again, patients with diabetes. So we see the impact of those heat waves on people who don't have access to work in a cool place during the day. We also see a lot of respiratory diseases, and patients are starting to make this connection. I do get questions about, my asthma seems worse this spring, or my allergies seem really bad this spring. Do you think it's maybe because of the forest fires in California? So even though we don't live in an area where there are fires, we're still seeing those effects on patients, again, with their allergies, asthma, and other respiratory diseases. The other thing that we see a lot in our patient population, we're a safety net institution, we take care of a lot of immigrants. And we've had many patients who have come from Central America, and they have experienced this entity that's been in the news a little bit recently, this sort of renal failure in young, otherwise healthy people that is, as of yet, not completely understood, but it's thought that it might be due to extreme heat events and working outside during the day. And as the climate gets warmer, those events get more dramatic, and people are dehydrated to the point of needing dialysis and losing their kidney function. So we see people who have lived through that in Central America, they immigrate to the US, and then we're taking care of them here in our population. So those are 3 things that come to mind that really affect the patients that we care for.
Thanks for that, Dr. Rogers. So one of the things that's wonderful about this panel, to everyone who's watching, is we have a real continuity of experience with how climate change matters to healthcare delivery. We have Kristen at AmeriCare, is an organization that works and tirelessly in trying, in many cases, to try and pick up the pieces after disasters happen. And with this work and other work is now trying to position resources before disasters happen to keep people safe. We've got Alex and Rebecca, who give real firsthand accounts about how this is playing out in real time in clinics, which I think their experience speaks to the experience of many clinics that have been engaged in this work to date, that when these disasters happen, our frontline clinics are really where the rubber hits the road. It's not at the hospitals. It's not even in many cases in the government. It's really through our frontline clinics. And to round out that perspective, we have Ben Money here, and Ben works for the National Association of Community Health Centers. Now, I could tell you about NAC, but you have Ben here, so I'm going to let him tell you about NAC, because many of you may not be familiar with it. But I really appreciate it, Ben, if you could speak a little bit about how you see NAC's role and the work that NAC's doing at the interface of climate change and the frontline clinics of our country.
Thank you, Ari, and I really appreciate the Globe for hosting this panel today. So the National Association of Community Health Centers represents the 1,400 organizations that operate 14,500 plus clinical delivery sites serving 30 million patients across the country. We've been in that role since 1971. And really since the inception of the Community Health Center program, environmental health, that broader umbrella, has really been a focal point of our efforts, recognizing that the impacts to patients at the community level, at the environmental level, directly impact their health. One of the things that we clearly recognize also is that on our federal authorizing statute, Section 330 of the U.S. Public Health Service Act, there's language that calls upon health centers to actually address air and water quality issues as they impact their patients' health. And so this is really within the lane and the scope of community health centers. And so what we've been doing at our new environmental health program at NAC is really trying to focus on those things that health centers are currently doing and create opportunities for them to address the impacts of climate change on their patients in areas that are within some of their current practice capabilities, recognizing that health center clinicians, clinical teams are really overstretched in terms of still being in the pandemic, but also all the, the challenges of operating frontline primary care practices that serve low-income individuals and individuals in rural areas. So the issues that we've really been focusing on are awareness and activation around the issue. We're very much engaged with Harvard on the patient-centered resilience from extreme heat project, as we call it, utilizing this toolkit and preparing to launch learning collaboratives this upcoming year. The other thing that we've been focusing on is energy efficiency and resilience of health center operations. We have partnered with Capital Link and Collective Energy to establish a charge partnership, which is designed to be a turnkey operation to help health centers put solar microgrids in their facilities. So solar panels, battery backup systems, and generation to allow health centers to be up and operational immediately after storms and other events that cause power outages. These can be climate related, but also related to just the stress on our electrical grid. And so assuring that patients have access to care is critical for us. We also have really been leaning into telehealth. I mean, that's one of the things that really emerged during the pandemic. And we want to keep those service delivery strategies to create access available, because they do lower the greenhouse gas emissions of the health center visit. And then we're also focusing on food security and waste reduction, clearly recognizing that food waste as a contributor to greenhouse gases, but there's so many intersections between food security, food as nutrition and health, as well as waste reduction. And so we are very much focused on developing activities that engage our health center community in awareness and education. And we've partnered with Eco America on that. We also are partnering with the Institute for Healthcare Improvement, IHI, in their Climate Can't Wait work group. And then we are really focused on strengthening resources to address social drivers of health and the environmental related needs that patients have. So within a year of launching our new program, we've got several initiatives underway with a clear recognition that the patients that health centers serve are hit disproportionately. As we like to say, they're hit first and worst by climate-related events. And it's so great to have partners across the country and within health centers that are really leading these efforts.
Thanks, Ben. That was an excellent overview, and it's quite a scope of work. As you mentioned, it's gotten underway in just the past year. I'm mindful that Dr. Rogers, whom was gracious enough to join us on very late notice, also has a real job, which is caring for patients at Cambridge Health Alliance, and we'll have to step off in a few minutes. So if it's okay, I'd like Dr. Rogers to ask you one more question before you have to step away. And that's to think about how you would see tools like what's in the toolkit potentially being useful to someone in your shoes. And to be perfectly clear, one of the things I think we've talked about is we know this isn't, this is a launch, but we by no means expect this to be perfect. And so, getting your perspective on how tools like this might be useful and where the challenges are going to be, I think will be really helpful to hear.
Yeah, absolutely. And one thing that was fun about this project is bringing the opinion of someone who works seeing patients and talking about, well, what is feasible for us to bring into our daily life of the 20-minute visit and seeing patients back to back. So one thing I imagine is, so this patient I just described, say, comes into the office and says, this is a really hot week and I'm having a hard time in my job as a plasterer. That's what he does. And he also has type 1 diabetes. So I could bring out the sort of toolkit that was already written about diabetes and heat, something that I had reviewed in advance and could easily talk him through and give him to bring home to review that material. So I think having materials on hand to talk with patients about in these clinic visits is really going to be really important. I have a group of people at CHA who's really interested in climate change, and we're sort of planning on meeting in the spring, I think, to review all of these materials about heat. So we're really ready to roll them out into our clinics when the first heat wave comes around. So I'm excited about that. So we can do that one-on-one conversation with patients in the office. I think the next step, which is going to require, engagement with more people at the institution, but a sort of aspirational plan would be, is there a way we can message our patients directly when there are things like heat alerts and let them know, here, make sure you're hydrating, here are things you could do with your medication, or message your doctor or nurse practitioner to ask, what you should be doing with your medication. So there's the things we can do in the office visit, and then there's sort of proactive communication. And we do this already. We message people, this time of year about flu shots and getting your flu shot. So we could be messaging people in the springtime about, pollen and the air quality and their allergies, message them early in the summer about heat waves coming on. So there's precedent for this.
Well, thank you so much, Dr. Rogers. And we look forward to being in touch in the spring, particularly as we gear up for pollen season and heat season. Thank you so much for being here. I want to give the next question to Kristen. Kristen, you've been working in the field of disaster management, I think, for your entire career. But what I wanted to ask you is, how do you see these resources as being different from others that people might Google, right? So if you were to Google, heat, how to deal with heat wave, or, what do I do before a hurricane, or these things, what in your mind separates those resources that are out there from what's a part of this toolkit?
So I think the big difference is that these resources are targeted to a specific community. They are targeted to the community health centers. So we started this project by conducting a survey, and then we implemented focus groups to do a deeper dive on the survey results to try to really understand what is needed, what is beneficial. We found that, over 80% of people surveyed were feeling that they were in need of resources like this. Fewer than 20% of respondents indicated that their health centers were very resilient to weather-related disasters. So there's a tremendous need out there. But one of the things that I've seen over my career is that when it comes to preparedness in the health system, the initial focus is always on the acute care hospitals first, which makes sense. That's where people are born. That's where people die. That's where trauma patients go. And then through other disasters, we've seen an expanding focus to places like nursing homes, right? And that's been, after certain emergencies, disasters where there have been higher impacts on nursing homes. But the health centers are at that far outer ring of the healthcare system. And so the attention, the funding, the focus, starts with the hospitals, and it really doesn't get all the way out to these community health centers. At the same time, as you mentioned earlier, and as Alex and Rebecca have highlighted, the people who are most in need of these resources are the ones who are being seen at these clinics. So we're seeing a situation where the greatest need for health institutions and the greatest needs in terms of the patient population is coming together in these community health centers. So one of the things that makes this project so important is that we are working right at that nexus of need and vulnerability and trying to mitigate it where it starts, right? So if we can keep people healthier from the outset, if we can keep clinics open and functioning from the outset, people will have better, healthier lives, and it will reduce more severe illness and injury, and will reduce greater burden on the healthcare system as a whole during disasters.
Thanks, Kristen. Alex, I'm wondering if you could follow up on what you heard from Kristen. Do you agree with this idea that from where you sit, I mean, you do teach at ECU, and you had a career, I think, that has spanned a long amount of time where you're at. Do you see that dynamic? And importantly, especially given where you work, how has your clinic already responded? Because you guys have obviously, this is not, you've seen the reality here. So I'd be interested to hear your perspective on those 2 points.
Absolutely. I totally agree with Kristen. We are trying to be proactive instead of reactive, so we can improve that population health and decrease those health disparities by educating our patients. So we all know it takes 3 times for someone to hear something to actually do it. So we're being proactive and already talking about hurricane season now and flooding. And you might say, you're out of hurricane season. It's not the time. It is the time. Because if we don't start preparing now, come June, they're not going to be prepared. But more importantly, we experience nor'easters on the Outer Banks, and it can happen overnight. We may have some warning. We will have flooding, and then we have the long-term consequences. So by utilizing this toolkit, which is what we have been doing since the summer, began literally the week after that patient was admitted to the hospital. And of course, that not only caused a hospitalization, decreased kidney function, it was a cost to the patient, and as well as the mental aspect of he was sick and then couldn't work. And so it was just a vicious cycle. He came in a week later, and I was able to give him the toolkit. And it was a joy to be able to do that. But we also are disseminating it in our clinic with our administrators. Lynn and Cindy, Lynn is our director and Cindy is our practice manager, and they have been working together to utilize those aspects of the toolkit so that they have the checklists in place to make sure our clinic is prepared if we are going to experience a nor'easter and lose power, et cetera. So it's a multifaceted level. And then again, that provider education, working with my fellow nurse practitioners and our physician colleagues that are in the clinic, and providing them the tools from the provider level, and then the patient education, and showing exactly how easy it is to go over this. It takes just a couple minutes to open up the weather app and say, do you have this on your phone? Do you have the alerts on your phone to know that we have a heat wave coming, or that we have coastal flooding and we're going to lose the highway and you need to have your prescriptions refilled? Simple things like that. And as the other comment was made about what's next, messaging patients ahead of time is absolutely what I'm hoping is on our horizon, to add to our electronic health record, and even including the toolkit into their electronic health record chart so that they can pull it up at home.
I think one of the things that your comments remind me, Alex, is that in all this work that Kristen described, what we heard from people like you around the country was that in the face of the challenges of the past few years, which are arguably unprecedented in anyone's memory, people have found ways to build resilience because we have to. And yet, as Ben mentioned earlier, and Kristen alluded to, I think resources have not necessarily kept pace. So I wanted to ask Ben, we're looking at some of the biggest investments from our government in climate change, both on the mitigation side and on the adaptation side. And from where you sit, how do you see that, if at all, going towards, arguably, I think one could make the case that we probably are underinvesting in these clinics that NAC represents at baseline, given the communities involved and the reality that I think comes as a surprise to many people that 1 in 10 people in this country are being served roughly in frontline clinics. Can those funds benefit this work? Is there a way for people to advocate as to how those funds might benefit climate resilience in the front lines?
Absolutely, Ari. In fact, the Inflation Reduction Act has significant resources for organizations, particularly organizations that serve low-income communities to address climate change, from the tax credits to some of the other incentives that are built in. And for the first time, nonprofit organizations can actually take advantage of some of those tax rebates and be able to lower the cost of particularly developing solar initiatives. So we have a good example from our health centers in Puerto Rico that actually were supported by both AmeriCares and Direct Relief in developing these solar microgrid projects after Hurricane Maria, where the hurricane knocked out the power system island-wide for months. And so healthcare organizations can't operate without electric power. And with the installation of these solar microgrids after Hurricane Maria, the health centers that had these capacities were able to withstand the island-wide power outage back in April of this year, and were able to deliver care to their patients, and not just medical care, but they were able to offer their facilities to charge battery-operated medical devices, to run power for water pumping stations, to be open and accessible for services such as food distribution, clothing distribution, and other needs. In fact, there's a concept of a community resilience hub that's out there. And so the intent is for health centers that have these capacities to really extend their resources into the community. And one example of that is Crescent Care Health Center in New Orleans, Louisiana. They actually are in the final stages of installing their solar microgrid, and they will be part of a community resilience hub called a community lighthouse. As you know, New Orleans suffers from climate-related events on a pretty frequent basis. And when you think about not just the storm, but the aftermath, there's excessive heat involved in days following a storm as well. And in fact, after Hurricane Ida last August, there were 19 New Orleans residents that died from excessive heat. So having a health center that has the ability to generate its own power, that health center can not only provide medical care, but also be a cooling center for the community. And the Lighthouse Initiative in New Orleans is part of a community-wide network of nonprofit resilience hubs each one powered by a commercial scale solar system with battery backup capacity. And so the intent there is to create this network that is ready and operational immediately after a climate-related event and during climate-related events to actually provide care for communities. So we see this funding, this historic funding from the IRA, as being really instrumental to not only helping health centers make that conversion, but being ready and prepared to protect patients during these climate-related events. In fact, there's also provisions within the IRA for electric vehicles. And there are companies that produce mobile medical clinics, as well as passenger vans that are in the process of converting fleets to either hybrids or fully electric vehicles that can provide care during power outages, but also be able to help power systems because those vehicles actually have the ability to use power sources and bring power out into the community. So I think there's some unique opportunities with IRA that health centers can really benefit from, and we're really positioning ourselves at NAC with Capital Link and Collective Energy to take advantage of these opportunities to the maximum capabilities possible.
Thanks, Ben. I was hoping I would get an answer something like that. It's encouraging to know that resources can be used to the benefit of protecting the most vulnerable people served at FQHCs, free and charitable clinics around the country. I'm going to pivot now to questions coming in from the audience. I'm grateful to those who have done so already, and for those who haven't, please chime in. The first question I want to pose to you, Alex, it's a question from Karen Gladfelter, and she asked the question: how do clinicians work to encourage administrators to take a stronger stance on climate change, resilience, et cetera, especially when those administrators stress that the focus has to remain on near-term staffing and funding? I don't know what the dialogue was at the DARE clinic, but I think it could be helpful to hear how this played out in your experience.
Absolutely, great question. I think I'm in a unique setting though. So because if I compare myself to colleagues that are not in a free clinic setting that have grant funding and support like AmeriCares and Biogen, et cetera, it's a little bit different. So unique is the great word. I was approached by the director, and Lynn was gracious and said, "Hey, is this something you're interested in? I think it might be a good fit for you." So I had buy-in from my administration day one. I think the big thing is don't go to your administration with a problem. Go to your administration with a solution. You can have the problem, but you've got to work out the solution when you go. And that's how you're going to get that buy-in. So, going to administration and saying, "Hey, here is a toolkit." I mean, because it's available. How can we implement this in our clinic? How can we be conscious about improving the quality of care? I think is the biggest success I could see. Others?
Well, yeah, let me ask that question a slightly different way to Kristen. So Kristen, okay. You spent a tremendous amount of time working with administrators on the operational side of clinics, right? So the question was posed from clinicians, but what would you say to the folks who are running clinics who are seeing, they're the ones having to deal with the power outages and the supply issues, and what do you think are the things you've seen that might be effective for them to think about in the context of advancing resilience within the clinic?
So I think I would tell them, look, you need to start somewhere. And this toolkit is free. It's available to download. So many of the resources that we have, they don't cost any money to begin implementing, right? Things like on high heat days, close the blind so it doesn't warm up so much inside the clinic, right? Like that doesn't cost anything. There are a lot of very simple, low cost, no cost things to do. Start somewhere. And this is a great opportunity to partner with the clinicians, because the clinicians can be working on the health aspect, the administrators can be working on the organizational and facility aspect of it. So it really is a multi-pronged approach. We have seen over our years in this area that there are incredibly simple things that clinics can do that make such a huge difference when disaster strikes. One of the simplest ones seems so obvious, but it's an eye-opener for so many people. Maintain a phone list of everybody who works in the clinic, right? So much is electronic, but keep a piece of paper and make sure everybody has it, and you have the name and phone number. And if you have more than one phone number, an email for everybody, just make sure that you can reach everybody who works in your clinic during a disaster. Things like that are so simple, so easy to get off the ground. You don't have to start with microgrids, right? You don't have to start with water purification systems. You need to start with being able to contact each other. You need to start with calling your local power company. This isn't true everywhere, but in many areas, the power company maintains a list of critical infrastructure. And if you are on that list, you are on the priority for power restoration. Just make the call, right? You're a customer of theirs. Make the call and see if there is a list, see if you can get on it. And things like that are going to take you a long way. So don't think about the global crisis. Think about what's happening in your clinic. Start small, start somewhere. And we've got plenty of ideas and opportunities around that.
Sounds like some very good suggestions, Kristen. Thank you for those. There's a question here from someone who identified as LexCan, which is a question that's focused on patient awareness to climate change and their health. But I want to pose that differently to our panelists. So Alex, I'd like you to weigh in on that. What you've heard, are you hearing your patients come in and say, something's different here and I think it's climate change or something of that tune? But to Ben and Kristen, I want to hear from Ben, the folks you work with at NAC and the clinics, are you hearing this bubble up from them? And Kristen, from your work at AmeriCares, in the work you've done on disaster management, how much is climate change coming into these conversations? And just to give people a chance to speak in equal order, I think I'll start that one off with Ben, if that's okay.
Okay, thanks, Ari. And particularly the health centers that serve the homeless and those caring for agricultural workers have a lot of experience in supporting patients that are exposed to extreme heat and other climate-related impacts. And we really are looking forward to implementing this tool through our learning collaborative to provide them with a comprehensive set of resources and strategies, because they are hearing it, and particularly those health centers that are most exposed to some of the greatest disasters that we've seen in the last few years. And I think about La Clínica de la Raza in Oakland, California. They experienced the catastrophic wildfires in 2020 at some of their sites. And as a result of that, their staff started a climate change working group. And they've been actively preparing their patients for climate change. They've been involved in advocacy around reducing emissions, as well as environmental stewardship. And so they actually have been very active in providing air quality and heat wave text alerts to their patients. And they're also looking at solar projects within their clinical sites. And then I think about La Maestra Community Health Center in San Diego, California. They saw a lot of their pediatric patients disproportionately suffering from asthma. And so they actually implemented a home visiting program where they work with parents on trigger mitigation and also are very attuned to changes in air quality and temperature as it impacts their patients' health. We also know that there are a number of health centers that have actually decided to go, off the grid, if you will, to be able to have independent power, as I mentioned before, to be ready to support their communities during disasters. And a lot of times that has been a result of their inability to rely on the current power system. So for example, in California, you have situations in which, because of the load on the grid and the fear for the grid actually starting a forest fire, they actually will shut down power in certain areas. And so it's become an essential function of business just to be able to have 100% renewable power through a solar microgrid project. But really do feel like, there are so many examples in which health centers are seen because they're serving the patients that are most vulnerable and they're on the front lines in those communities, that they are responding to the need. The other thing too is, we are also seeing just some of the cost benefits of being able to support patients by being autonomous in terms of power. And those cost benefits are only going to increase with some of the available discounts through the Inflation Reduction Act. So I think that the awareness by community health centers of the impact of climate change is here, it's now, and more they are creating the awareness to their colleagues across the country.
Thanks, Ben. So let me turn that question to you, Alex. So we've certainly seems to be, from Ben's description, a lot of engagement around the community health clinics. What are you hearing from the people you serve?
Ironically, literally, I was in the clinic yesterday and had a patient who came in with tick bites. And she said, it's December. Why do we still have ticks? We still have mosquitoes. What is happening to our climate? And that was a kind of a turning point she was being seen for. We have definitely seen a lot of our local population say, there's flooding here that's never happened before. It's never flooded like this. 7 feet of inundation of tidal flooding above sea level and going into homes. And they are recognizing the fact that the island is changing, it's evolving. It certainly has evolved in the 30 years I've been there, watched it change. It's the shifting of the sand, so to speak, but it definitely is a different effect. And they are commenting, it's hotter. And wow, why do we have smoke? We don't have forests on the island. We're getting those wind shifts that we haven't gotten before, or is in recent years it has increased. And there are days where we have to make sure we're talking about that air quality. So they are definitely coming into the clinic with voicing concerns directly related to the climate, and how can they make a change? So, the irony is, I had some folks in my clinic yesterday and they said, where's the bus system? There is no mass transit system. So we don't have that, but that's a drawback too, because that is access to care. So we've increased the use of telemedicine, which is improving our climate there. Small changes.
Yeah. So those are two compelling views from two different angles on these issues. Kristen, I want to give the same question to you, but in the context of your work at AmeriCare. So, how has climate change influenced AmeriCare's approach to what it does? And how does it fit within how you think about your work?
So there's a couple things in that. I mean, the one thing that I really think about is the real difference between what we hear from clinics now versus when our preparedness work started a few years ago. Then it was more, we have hurricanes, there are hurricanes here, we know what to do. There was a real sense of this is just part of the normal life and part of the normal cycle. And and as we've seen over time, people are starting to feel it a little bit different. People are starting to feel a sense that this is part of something larger going on, and that this is part of more of a global shift as opposed to kind of local weather patterns. And there's a real awareness around that. I think also COVID has been a big eye-opener for clinics in really helping to understand how well they are or are not prepared to face disasters. And that's been a real shift that we've seen as well. As an organization, we respond to over 30 disasters a year. And we are going to be looking to the future of responding to disasters on multiple fronts. And what does that model look like when one side of the country is experiencing fires and the other side of the country is experiencing hurricanes, and all of those intermediary impacts. So it's definitely something that we're thinking about on the horizon, but there's definitely been an awakening in the last couple of years. Even just a few years ago, nobody was talking about climate in the clinics that we were working with. And now it's something that people are aware of, and they are thinking about it. And stories like Alex has been sharing today, there are hundreds and hundreds clinics, thousands across the country, who can share similar stories of what they're seeing in everyday life. I keep saying that this is a global crisis, but the impacts are personal. And organizations like AmeriCares and like the clinics that Ben works with and Alex's clinic, we work with people in communities who are experiencing this on the front line, who are individually, personally feeling the health impacts. And that's been a big part of this project, is to try and take this sort of global lens to it and turn it down into the personal, to impact the individual lives of individual people. Because at the end of the day, it's our neighbors. These are our communities. These are our people. And that's what's so important here.
Wow, that was a great way to wrap up this part of our conversation. I hope everyone watching can appreciate the extraordinary work of the three individuals, and as well as Dr. Rogers, who had to leave earlier, dealing with the climate crisis in real time, and the commitment that they've all shown to getting us further down the path of really protecting communities that are and individuals who are most at risk. Thank you all so much for being here. I want to turn back now actually to Dr. Radhakrishnan and invite her to turn her camera back on. And I actually have one question for her as a way to close, which Dr. Radhakrishnan, can you hear me okay? I just want to make sure.
I can hear you and see you, but I'm not able to switch my video back on. It says the host has stopped it.
Well, we'll work on that at the moment, but let me pose the question to you, which is, you had mentioned Biogen's commitment to go fossil fuel free, which is extraordinary in the context of commitments to address the climate crisis. But why would Biogen support a project like this that focuses on the frontline clinics and climate resilience?
Yeah, so thank you for that question. And I've actually truly enjoyed the conversations and the questions and the discussion so far. So as a healthcare company, everything we do at Biogen is basically focused on helping people and patients live fuller lives. So we focus on people, their families, and obviously the patients, as well as the current or future prospective employees that may join us, the customers we interact with, the healthcare providers, payers, our investors, professional associations, community members, and everyone else we kind of interface within this ecosystem. Through our Healthy Climate, Healthy Lives initiative, which I mentioned in my opening remarks, we recognize that the climate crisis is truly a health crisis. And we must engage with all our stakeholders to advance a bold action. And you actually heard a lot from our fellow panelists. I also was looking at the questions, some extremely important questions being posed. So one of the pillars of Healthy Climate, Healthy Lives is advancing strategic collaborations. By supporting the work of organizations like yours, Harvard Chance, Change, the AmeriCares, we do believe that we can for sure create a healthier, more sustainable and equitable future.
Well, thank you so much for that. As a closing set of remarks, Dr. Radhakrishnan, thank you again to our panelists. Thank you to those who are able to join us. This event will be available subsequently in case you know of other folks who would want to watch it. Please make use of the resources and please give us feedback. We very much are eager to make what we've done better. And with that, I wish you all a good day.
Thank you, everyone. Truly appreciate it. And thank you so much for this wonderful panel.